Good afternoon, respected judges and all dear delegates. So today I'm going to present a case on bilateral optic atrophy in Crouzon syndrome. So there has been no financial support and sponsorship for this case, and due consent of the patient has been obtained. So as we all know, Crouzon syndrome is an autosomal dominant disorder with complete penetrance and variable expressivity. It is caused by the mutation in the fibroblast growth factor receptor 2, which causes premature closure of the cranial sutures. So the case report that I'm going to present had presented to us at our OPD, a 7-year-old male child from Assam, who complained to us with the chief complaint of inability to follow light or hold objects properly, drowsiness and reduced appetite since 1.5 years. He was brought to us by his parents, and according to them, his vision has been deteriorating ever since, and the features had started developing from birth gradually. So his medical and surgical history were not that contributory. They had visited multiple physicians in their hometown, but in vain. So on the ophthalmic and general examination of the child, we found that his visual acuity had actually deteriorated to finger counting close to face. It was insidious in onset and painless. Proptosis was noted. A protrusion of 24 mm was seen in both eyes. Exotropia of the left eye was noted around 45 degrees. And he had shallow orbits, wide-set eyes. On direct ophthalmoscopy and IDO examination, we found that he had bilateral optic atrophy. He also had beaked nose and depressed nasal bridge, an underdeveloped upper jaw, and open mouth. Maloccluded teeth were seen when he opened his mouth, and skull and facial dysmorphology were also noted. His CNS and CVS examination were, however, within normal limits. On slit lamp examination, the positive findings were he had proptosis. There was the anterior chamber looked proper. Interpupillary distance was 65 millimeters. Corneal diameter was 12 millimeter. The intraocular pressure was normal, and rest every anterior segment finding was almost normal. So this was the patient. The child was brought to us on the first day when we made a clinical diagnosis, and on the second day for follow-up, his mother, as visibly we can see that she also had a left eye exotropia and a Crouzon syndrome. So this was the fundus photograph that was taken, which showed bilateral optic atrophy of the child. An ultrasound B scan was done, which was within normal limits. A CT scan was done, which showed a bilateral exophthalmos. So all the investigations were almost within normal limits. We have also gone for an X-ray skull, PE, and lateral view. So MRI orbit and brain with orthopantomogram has been advised, and patient has not followed up with these reports yet. So a clinical diagnosis of Crouzon syndrome was made and treatment was initiated. So with the treatment plan, we had started on general lubricating agent, antibiotic eye drops, and genteel gel at bedtime, multivitamin supplements, and we have advised follow-up. The parents were counseled of the nature of the child's disease and the reason for poor sightedness. We have also suggested them a neurology opinion to rule out any intracranial hypertension, and dental opinion and plastic surgery opinion. So in the patient, we have seen craniosynostosis from the CT scan that we did. Proptosis was there, left eye strabismus was there, but there was no keratitis. So this was the skull, PA view skull was done, and lateral also, which showed hypoplastic maxilla. The mixed dentition can also be seen with mandibular prognathism, and some few cerebral impressions can be seen. So, and discussion part, we all know that Crouzon syndrome is a genetic defect. It's an autosomal dominant defect, and many studies have been done all around the world, in India, where such craniosynostotic syndromes have been studied. And not only that bilateral optic atrophy, but also such patients present to us with astigmatism, anisometropia, and strabismus. And also, if we go for an MRI or CT scan brain, we see that there can be progressive hydrocephalus or chronic tonsillar herniation and jugular foramen stenosis with venous obstruction. So that has also been found with significant frequency. So these are my references.